Hey guys, welcome to another episode of the Four Pillars with Kevin Davis. Today we're going to talk about, is your lifestyle on track for longevity? Key signs you need to know. We're going to talk about the whys. Why is it important that you need to know that? We're going to talk about things, how you feel, how you can identify if you're on the right track by how you're feeling, how your daily lifestyle is. We're going to identify the signs of metabolic dysfunction. And this is something simple that you can do with simple labs. And then we're going to go a little bit deeper into, my dashboard to where it tells you a little bit more about the things that are in 10 areas of your life that, if you're not tracking these things, then you don't know if you're getting to that point where you are on the right track for optimal health. Now, if you don't know me, my name is Kevin Davis, and I'm an online health coach. I'll do things a little bit different because I make you the CEO of your health. And I do this in a way that is more personalized. It's not just something where we just give you a exercise plan and a diet plan and then let you go. We take a deeper dive. We can go into labs and DNA and genetics and things like that to help you identify what is the best thing for you. So stay tuned to the end, and I'll talk to you a little bit more about that as we get there. So the question of longevity, why is it important that we talk about longevity if it's something that's like years away? In our minds we think about longevity, we think about 10 years, 20 years, 30 years down the road, depending on where you're at in your life. But the thing about it is if you concentrate on these factors now, you're going to get some benefits later on, but you're also going to get the benefits now. So some of the things as we think about with longevity, you need to think about these things. Is you're going to improve daily performance. Whether that is at home, whether that is at work or in the gym. If you're doing the things that is optimizing your health, then these things are going to be able to be improved. I even talk about like sex life with a lot of guys that I coach. If your sex life is not where it's at, something is out of kilter. You need to get that back into a way that is going to optimize your health. So you're going to enhance your daily performance. You're going to feel better now. You're going to improve your quality of life. Not only are you going to be able to do these things, a lot of times we can kind of force ourselves to do some things like get up and work out, even if we don't feel like it. We get up and go to work, even if we don't feel like it. But the thing about it is when you start optimizing your health and with longevity that is connected with that, you're going to improve your quality of life. You're going to feel like doing these things. You're not just going to be, it's not going to be a chore. It's something that you kind of look forward to. And then the third thing, obviously, the things that we talk about with longevity, most things is we're going to prevent chronic disease. If you are in my position and you see this over and over, I see people come in their 40s, 50s, and 60s, and all of a sudden they're having diabetes, they're having high blood pressure, and things like that. And they think, oh man, what's going on here? I'm doing the same things I used to do when I was in my 30s. The problem is those things like diabetes, those things like high blood pressure, Alzheimer's, they don't start and then the next day you start having these symptoms. It's a progression. It's over time. So if you can uncover some of the things that's leading you down a road that you don't want to go, then you're going to be able to prevent these things. And this is kind of like what we're talking about here. But probably the most important thing you need to know is this process of evaluating yourself with the things that we're going to talk about, it's not a one and done deal. It's not something you just do it one time, set it and go. It's an ongoing thing. It's a thing that you do on a regular basis. What I did 15 years ago, I don't do the same things that I do now. My health has changed. My body has changed. So I do things differently now than I did before. For instance, carbohydrates. I used to have a really, really low carbohydrate intake. Now I eat more carbs. Why do I do that? My body has changed, and I'm able to process that energy a little bit better and use it and store it in a way that is more efficient for me. So I treat it as like this things as a game almost. I take it in sections. I don't think about, I do think about, 10 years from now, but I think about, okay, the next 6 months, what do I want to do? And I try to accomplish a goal. Once I get that goal and I'm able to maintain it, then I move on to the next one. Then I'll move on to the next one. So it's an ongoing thing. Do I mess up? Oh, if you follow my life, you know I mess up. But on a consistent basis, I do the things I need to do. So if you do this for 6 months, if you are, even probably if you do it for 3 months, or actually, let's just step back. If you did this for a month, if you start making some changes and you did it on a daily basis for 1 month, if you just would give me like 1 month to work with you and you did exactly what I told you to do for 1 month, you would feel so much better. And I can almost guarantee that you'd feel better. A lot of people lose a significant amount of weight during that time as well, too. They gain muscle. They have a different outlook. The mental process changes. So just remember, this is not a set it one time and forget it. It's an ongoing process. But the key to it, and that may be overwhelming to some, but the key to that part of it is when you start feeling better and you start doing these things, so many times I have people that come in and they don't exercise, for instance. They don't feel like exercising. We start making them feel better. We start feeding their body what they need to do. They lose a few pounds. They feel like exercising. And they start asking me, what can I do? Or what can I do more of? They want to do more of it because they feel like it. So that's the progression of it. You just got to get started with this. So let's talk about the 3 different sections as far as like how can you tell if you're going in the right direction. And the first thing is, how do you feel? That's very obvious, I think. No matter what we do with the lab work that we want to talk about, different things that we can measure and things like that. The key, I think, is how do you feel? Because if you feel good, then more than likely you're heading in a good direction. But if you're tired, if you're not having the energy, if you're not sleeping well, if your sex life isn't what it should be, then something's off. So you want to look at these things. And the things you need to think about, and these are, I put in 6 different sections, is what is your energy level? Number 1, are you able to get up and do the things that you want to do? If you're not, then your mitochondria, which is your powerhouse of your energy production of your cells, is something's off on that. Is it diet related? Is it toxins? It could be different things. So we have to identify, what's our energy look like? Number 2, how are you sleeping? Again, this goes back to one of my 4 pillars of health. If you're not sleeping well, nothing else is going to work. The other night, me and Jenny went out and I had some ice cream and I ate a little bit more than what I should have. I didn't sleep well that night. The next morning, I worked out, but I didn't really feel like working out. My sleep quality, and especially on my Oura Ring, showed that I had a lot of disrupted sleep. And, that just sets me up for failure the next day. Again, I'm human just like you. There's going to be times where I don't do things perfectly. But if I'm tracking these things, it's in the back of my mind. I need to start making these decisions. Then I start thinking about the next time we go out, am I going to do the same thing I did before and feel bad the next day? Or do I want to feel better the next day? And, I'm not telling you 100% I do one way or the other, but it does cross my mind. And when it crosses your mind, then you're going to start making some different choices. Number 3, mental clarity. How do you feel? Do you have a brain fog? Does just not things seem to be clicking? Can you not remember things? Those type of things. If you're not having that, or if you're having those symptoms, then something's off. Number 4, emotional well-being. There's a lot of studies that show when you start nailing your diet, anxiety, depression, those type of things will markedly improve. I've even read one study where it showed that is more improved than with medication. So there are things out there that can help you with your daily lifestyle that helps you right now. Number 5, we talked about just a minute ago, your sex life. How's your libido? Is it getting better? Is it getting worse? Are you having sex more often, about the same, or less? What is your desire? You may be able to perform sexually, but what's your desire? Do you just not feel like doing it? Are you tired all the time? It's a very good indicator of your underlying health. And number 6, your digestive system. Are you having a lot of gas? Are you bloated? Do you just feel are you having heartburn? If you're having those things, then something's off. Are your bowels not moving? They should be moving every day. If they're not moving on a daily basis, something's off. You need to correct those things. And a lot of times diet plays a big part in that. So those are 6 things you can kind of like just think about yourself right now. where, out of those six, do you have one, two, three, or do you have all six of them that you're not really thinking, okay, I could get better in each of these areas? And going back to my just kind of like forecasting with my dashboard, I have 10 areas on my dashboard that tells you in different sections like this as far as what labs goes with that as far as improving that. So that's just kind of like where I'm leading with this as well. So if you're not noticing, improvements in these areas, reach out to me, comment here below. This is where I have problems at. This is my problem area, and just kind of like get a conversation going. I'd love to see where you guys are at with that, just so that I can kind of like maybe do some future planning for a future podcast as far as what is some of the main things that my listeners here are experiencing and how I can help you. So, second section, identify 5 signs of metabolic health. Again, we've talked about metabolic health a lot, and I'll continue talking about this because I think it is the root cause of so many problems in our health, in our bodies, and things like that. So, metabolic health is how you take in food and how you process that food for energy and for energy storage. So, are you storing more in fat or more in muscle, those type of things. So these are the 5 signs. If you have these are metabolic dysfunction. These are the things you need to improve. And, the first section that we talked about, basically sit there and just think about them right now. This section includes a little bit more because it includes some labs, but it's just some basic labs that you get at your doctor's office. You more than likely, if you've got blood work, you've got these labs I'm going to talk about, so you can go back and look at them. If not, get up with me. We got some opportunities to help you get labs if there's something that you can't get to. But number 1 is decreasing your waist circumference. And guys, 40 inches, women 35 inches should be your waist circumference. When you have smaller waist circumference, you have smaller visceral fat. That's the fat on the inside around the organs, and that's what's detrimental to your health, and that's what metabolic dysfunction is, one of the things that we talk about. So what is your waist circumference? And that's around your belly button. So see what your waist circumference is around your belly button. For guys, if it's more than 40, if women more than 35, you're off. There's some other measurements you can do compared to your height. And if you're interested in that, comment below, and I'll make sure that I include this in your comments so that I can answer your questions. The second thing, as far as the 5 signs for metabolic dysfunction that you can look at, is your lower triglycerides. On your lab work, you're supposed to have your triglycerides 150 or below. That is ideal. Ideally, or that is in the normal range. Ideally, I think they should be less than 100. And we're going to talk about HDL in just a second and how I'm going to compare those two as well. But you want to have your triglycerides, because triglycerides is pretty much just how you're storing your excess sugar. So if you're taking in a lot of sugar, if someone comes into my lab or my clinic and they have high triglycerides, the first thing I think about is diabetes. Do they have diabetes? Because it's storage of excess sugar. It's other things as well too, with certain genetic disorders and with your pancreas and stuff. But anyway, basically on a high level view, I think of sugar first. So a lot of times you're taking in too much sugar. So that's an idea. That's something that you can improve for your metabolic health. The third thing is you want a higher HDL. That's your, quote, good cholesterol, unquote. Even though we're going to different talks about that, good versus bad, because cholesterol is all good for you, depending on what kind it is. But with HDL, you want it above 40 or 50, ideally. That would be in the optimal range. Now, going back to the triglycerides, to have really good metabolic health, if you have triglycerides to HDL ratio, you want ideally you want a 1-to-1 ratio there. So let's take this for example. Let's say you have a triglycerides of 70 and you have HDL of 60. That's roughly a 1-to-1 ratio. If you have triglycerides of say 150 and HDL of 50, so it's 150 of triglycerides, 50 of HDL. That's a 3-to-1 ratio. That's getting out of the ideal range. You want a 1-to-1 or 2-to-1 ratio. So that's an easy way to see what the optimal range is as far as that is concerned for your metabolic health, just with basic labs. Fourth thing you need to do is you need to identify blood pressure problems. If you have blood pressure and you're being treated for it, or if you have high blood pressure and you're not being treated for it, even if it's controlled, it puts you in a higher risk category. So ideally, what we'd like to see is someone get to the point where, if they have high blood pressure, they start making some lifestyle changes, they can maybe get off their medications. Then they're in the normal category. But even if you have normal blood pressure and you're on medication, that still puts you in a higher risk category because something's wrong because you're having to use medication to get that down. Now, do I use medicine? All the time I use medicines. I prescribe it every day. But ideally, we can do some stuff, hopefully, to get you off it. And the fifth thing is diabetes. Same thing as with blood pressure. Even if you're a controlled diabetic, but you're on medication, it puts you in that higher risk category as far as metabolic dysfunction. So we want to get to the point where we look at blood pressure and we look at diabetes. What is the root cause for you that's causing this? Excuse me. And how can you get maybe off these medications and still control them with lifestyle changes? So that's the second segment. You can identify metabolic dysfunction through your metabolic health. And that's something that we do on a regular basis. And it's pretty inexpensive to do with labs that you normally do at your doctor's office. So out of those 5 things, increased waist circumference, high triglycerides, lower HDL, being treated for diabetes, being treated for blood pressure. How many do you have out of those 5? Now, ideally, to be metabolic dysfunction in this sense, you have to have 3 out of 5 of these. I personally think if you just have 1, there's an issue because it's going to probably lead to something else down the road. But officially, for metabolic syndrome, you have to have 3 out of 5 of these. So let me know, which ones do you have out of those 5? Excuse me. And the third section I want to talk about is my longevity dashboard. And this is something that I include with my clients as far as online that I help coach. And there's 47 different markers. Now we're going to go into each 47 different markers, but there's 47 markers that we use on your blood test. Some of them are included like in your regular blood work. Some of them are a little bit different than you may have never had, but we put these in 10 different categories. And these 10 different categories gives us an idea of where do we need to work on with that specific patient. So we're able to identify deficiencies, whether it be like in your blood sugars, vitamins, your cholesterol, some of the hormones, that we talk about. Excuse me. We're able to identify different areas and you specifically so that we can specifically give you the best recommendations. And I've talked about the longevity dashboard. If you are interested in having like maybe a demonstration of the longevity dashboard that I have, if it's something that maybe interests you, but you're just not sure exactly what it is, let me know. We can set up a time and I can do that. Or if you'd like to just have a video, maybe I can do a screenshot of my labs and kind of give you an idea of what this looks like. Because it really does give you some pinpoint recommendations as far as the things you need to do. And the thing I like about this longevity dashboard that I have is it gives you articles that kind of backs up what it says. So if it tells you need to do implement like a certain vitamin or a certain exercise or something like that, it gives you the scientific papers behind that that tells you why they need to do that. So it's not just something that's haphazardly given out and say, okay, everybody needs to do this. No, it's specifically for you. So if you're interested either in the group coaching program or the one-on-one that I have, and you want to include the longevity dashboard, just reach out and let's have a conversation with you. So hopefully this is kind of give you an idea. It's like, okay, I need to sit down and I need to think about where I'm at with my health. What do I need to be doing? What direction am I going? And if you're having these things that we've talked about, whether it be in the first section, just identifying, how you're feeling, your energy level, your sex level, your sleep, those type of things. If you're struggling in those areas, maybe we can get started and identify where do we need to start with you to help. If you have some metabolic dysfunction, if you've hit 3 out of 5 of those signs that we talked about just a minute ago, that's looking, that's kind of like putting a light on some maybe root causes or root problems that you have that's causing these issues. And we can do that. And then again, if you want to talk about the coaching, I'd love to have a conversation with you too, because I think that would help as well. But the main thing I want you to understand is, and take away from this, is one, there's things you can do to identify where you're lacking. 2, it's never too late to start. And 3, it's a never-ending process. It's something that you're going to keep doing, keep adjusting as you go through your life. I'm 54 now. I'll be adjusting when I'm 64, 74, God willing that I'm still here, because He's the only one who knows that. But reach out to me. I'd love to have a conversation with you. I'll try and include some links into the dashboard so that you guys can get an idea of exactly what we can offer you and optimize your health. So, but right now, I'm going to talk to you about our catechism. And we're on what is the 6th commandment, and the 6th commandment is you shall not murder. Obviously, I think that's pretty much a given. I think that's something that we think about in our morals. We think, yeah, we shouldn't murder. But, Jesus even took it one step further. He took it, we shouldn't hate somebody. There's things that Jesus didn't like. There's things that Jesus hated. There's things that Jesus disrupted, like when they were trading coins and things like that within the temple. So there's things that got him upset. But, the things that get us upset, we have to sometimes think about, okay, step back. Why are we upset about things? Why do we hate this person? Or why do we not like this person? Maybe we have not given them the grace that God has given us. So the thing I want you to think about is, like, if you have some ill feelings towards somebody, just stop and think about, okay, why do I have these feelings? They may be justified, but just like how God's forgiven you, you can forgive those people too. And we can go into a whole story about, you don't have to be friends with them and things like that, but you can forgive them. But it's something that I think about. It's a matter of the heart. When it says, thou shalt not murder, is more of a act of outside, you actually doing something. But when you don't like someone or you hate someone, it's more internal. But that internal can turn into something external by you doing something. And I think that's when you need to go to the Lord in prayer and ask Him to help you with whatever situation that you have there. Anyway, I hope you guys enjoyed this podcast today. We will be talking with you soon. Remember, be fit and be faithful, guys.
This podcast is for informational purposes only. No patient-provider relationship is implied or established. This podcast in no way represents the practice of medicine. The information given is to be used at the listener's own risk. Please consult your provider before making any changes, as the contents of this podcast is no substitution for your provider's instruction.